Hi, this is Angela with Angela's Student Nurse Toolbox. We're going to talk today about the nursing process. And I'm going to give you some examples and kind of get you to critically think. This is the most important thing with the nursing process is to think about what you need to do. So let's go to the first part, recognizing cues. When we recognize cues, we need to be able to pick out what matters the most. Let's look at this example. A 70-year-old male presents to the ED complaining of a productive cough and SOB, which is shortness of breath. He states he's felt feverish. He has a history of smoking one pack per day times 40 years. Okay, so what is relevant? What is important with these cues? Is his age important? Yeah, he's 70. Okay. He's got a productive cough. What kind of things could we ask him about to get more information? What color are you coughing up? How long have you had it? Have you had this cough before? Because he is a smoker and short of breath. Is he short of breath with activity? Is it at rest? Because if it's at rest, it's a lot worse. He feels feverish. Did you ever get a temperature on you? What was the highest temp? How long have you felt feverish? And he's been smoking one pack per day for 40 years. Okay, so let's look at the next part. So we recognize some cues. Now we're going to analyze the cues. Analyze the cues means what does it mean and why does it matter? Okay, so now we're doing a little bit of physical assessment on him. When you listen, you hear that he's got crackles bilaterally. Is that important? Is breathing a vital thing to a human being? Yes, it is. His blood pressure is 144/84. Okay, that is above normal, but he is 70. Okay, so let's look at each of these vital signs. Heart rate 106. Is that good or bad? That's a little elevated, so that is some tachycardia. What could be causing that tachycardia? Maybe we're short of breath, we're anxious. Maybe he's got a fever. A lot of times when people have a fever, they might have an elevated heart rate too. Respiratory rate, here we go, we're 26. We know our normal respiratory rate is 12 to 20, so this is a little elevated. His temp's 101.8. Okay, so we got a fever. And then his O2 sat is 87% on room air. So those are our vitals. Now we're going to look at, and I always tell you, what is going to kill your patient first? Focus on that. Because, yeah, we have a few things wrong. He's got the crackles, his respiratory rate's elevated, he's got a fever, and his O2 sats are low. So where do we start? Okay, that's our next slide. Prioritize our hypothesis is where do I start? With all of these things, what's going to kill him first? So if you look at everything that you have right here in the vital signs, is airway and breathing vital? Yes. You need to do something about this low O2 sat. We don't want to see how low he's going to go. If we fix that oxygenation, okay, I get this to come up by either sitting him up or maybe giving him oxygen. I'm sure this respiratory rate will come down. His heart rate might come down a little bit and blood pressure. Okay, so he would be getting perfused a lot better. Next one. Okay, so we want to know what are your desirable outcomes? What might I do to help? Out of all of these things, let's see how we could fix that. First, we definitely need to fix that O2 sat. What's some simple things we can do? Maybe sit our patient up. Okay, if we sit him up, he might have a lot better of an O2 sat. Then his respiratory rate will come down, his heart rate and his blood pressure might come back to normal because he won't be very anxious and feeling short of breath. What else can we might do to help? Give him something for this fever because maybe that's causing his tachycardia, the heart rate of 106. Okay, maybe he needs a breathing treatment. These are just things that we need to anticipate our doctor ordering. It's not like we can go and order it ourselves. Putting him on oxygen, yes, we would need to contact the provider. but we need to be able to think ahead what we need to do and what's most important and why. The next slide, take action. What will I do? What interventions are needed immediately? So out of all those vital signs, we need to fix that O2 sat. Okay, because that is what's going to kill your patient first. We do not want to see how low he's going to go. So actions. So here we have charting. We have to chart all of our actions. At 1400, the nurse places 2 liters O2 nasal cannula on client. 1410, O2 sats are 88%. Nurse increased the oxygen to 4 liters nasal cannula. So the nurse put him on oxygen, gave it a few minutes to see if it was working, and it didn't go up enough, so we've increased that oxygen. Now the O2 sat's 91%. Nurse increases O2 to 6 liters nasal cannula. Client alert and oriented times 3. So you see how we have to document to cover ourselves? So we're going to look. We did these actions. Did it help enough? Okay. So that is where evaluation happens. Evaluate our outcomes. Did it help? It helped a little bit. It did bring him back up. Maybe this is his norm, his O2 sats, because he's been a smoker for 40 years, a pack a day. So maybe that's as high as we're going to get him. The nurse might need to call the doctor and say, all we got up to was 91. What further orders? Maybe he needs a respiratory treatment. So that's where evaluating outcomes. We want to know, did it help? Do I need to do something else or think about something else? And we need to chart what we did, what interventions. This is one of the major things that new grads struggle with, is making sure they recognize those cues and what did they do about it. So super, super, super duper important. So let's look. Did it help? Okay, so now at 1500, his blood pressure is 138 over 76. His heart rate's now 95, which is normal. Respiratory rate's now 18. That temp's climbing, though. It's 102. But our O2 sats are now 96% on 6 liters. So we fixed his oxygen. Now we can start thinking and evaluate, okay, what do I need to work on next? And more than likely, it's let's fix this temperature. Let's see how we can get that temperature to go down. So that is how the nursing process works. This is the whole point of us learning about the nursing process, is to let us learn how to think like a nurse. And that's what you need to do every day with every patient. Don't forget to subscribe to Angela's Student Nurse Toolbox. If you like this video,